my name's Paul. I'm the Manager for Oral Health Services at the Institute for Urban Indigenous Health in Brisbane.
My name's Rene Black. I work for the Institute for Urban Indigenous Health, and I'm a manager for the health services on the north side of Brisbane.
And what does that mean? What does a manager for the health services mean?
So health services on the north side are broken up across probably 4 to 5 clinics at the moment. I say 4 to 5 because the 5th one isn't actually belonging to our organisation, which is the Moreton Aboriginal and Torres Strait Islander Community Health Service. As a manager, I provide mentorship, management, leadership across 5 clinics, 4 much more directly than the 5th.
And how many staff?
Approximately, we have about 50 staff.
What sort of services?
So we deliver GP services to the Indigenous community, concentrating mainly on chronic disease management, but of course we handle acute care and primary care needs of people that need GP services. We also have wraparound services such as allied health and specialist, and some programs like rehabilitation programs, social and emotional wellbeing programs, as well as some service delivery in those areas of mental health and alcohol, tobacco and other drugs.
My name's Marty. I work for the Institute for Urban Indigenous Health in a regional service development role.
Great. And what do you like about the job?
Everything. I like the people I work with, the constant evolution, the rapid change. It's a very responsive organisation.
My name is Carmel Nelson. I'm the Clinical Director at the Institute for Urban Indigenous Health.
And what's the Institute of Urban Indigenous Health?
The Institute for Urban Indigenous Health is a regional Aboriginal community controlled health organisation. We have 4 member services who make up the Institute, and essentially we're a health body who provide a range of supports to our members, as well as working collaboratively with mainstream services to close the gap, to reach as many Aboriginal and Torres Strait Islander people as possible and provide excellent health services. So when I first came on board, I was employee number 11, and we've now got over 250 employees at the Institute. We had 5 clinics in southeast Queensland, owned and run by member services, and there are now 17 and soon to be 18 clinics in the network across southeast Queensland. I think that on the really positive side, I think some of the enablers or the things that have actually made my job easy is that we've recruited really terrific staff, and so as the organisation's grown, and I guess as for me, I've become responsible to lead a bigger team with a growing group of managers who I look after. Being able to bring really terrific people in the organisation who've got shared values and a huge amount of enthusiasm, lots of energy, and a real commitment to making things work definitely is an aspect of working at the Institute that has made some of those things about leadership and growing an organisation much easier than they might otherwise have been. And I guess in terms of the challenges, no doubt about it, it's been the rapidity of the growth, just the speed, going from an organisation where you see and know everybody every day to an organisation where, occasionally I'll meet people in an institute uniform and I have to introduce myself and find out who they are. The speed of growth, I think, has really been a big challenge for the organisation. And I guess shifting from an organisation that functions really effectively as a tiny entity to thinking about how you translate all of the things that have really characterised the Institute and made us what we are, that are the real strengths of the Institute, the lack of hesitation in innovating and bravery, I think, and willingness to hit the cutting edge and be leaders in the field and front runners and those sorts of things. So being able to keep all of those characteristics, as well, I think, as some kind of intimacy that comes of people who do have shared values, common beliefs, shared senses of humour, all of those sorts of things. Being able to bring those characteristics into an organisation that suddenly goes from 11 to 250 is definitely a challenge. I think that's something that many of us really do spend a bit of time thinking very consciously about.
Tell me about your shirt.
The Deadly Choices program, or Deadly Choices brand, is part of the Institute for Urban Indigenous Health. It's a program that started about 2 years ago now, looking at healthy lifestyles for Aboriginal and Torres Strait Islander people, but also through mentorship and leadership. We have quite a big team focused on Deadly Choices. It's a program that we run through all of the clinics and certainly starting to expand statewide.
And when do you score? When do you get a Deadly T-shirt?
You can get yourself a Deadly Choices shirt by having a health check, an Aboriginal and Torres Strait Islander health check at a participating Aboriginal medical service in South East Queensland or across Queensland. There's a number of them that are participating now, as far as sort of Mount Isa, the Cape, down to the Gold Coast, through Wide Bay, certainly getting out there. So if your local Aboriginal medical service doesn't have it, get onto them to contact the Institute about being part of the program.